Okay, let's talk about our patient today. Our patient today is a dentist. Young lady, a preeminent lecturer,
The dental hygienist
from Bulgaria,
Buffalo, New York,
Atlanta, Oklahoma, Vancouver, Canada, Boston, Kansas City, San Francisco, Montreal, Munich, Germany, London, and Santa Maria, California. And we're going to place 14 Lumineers,
8 Lumineers,
10 Lumineers,
6 Lumineers,
10, 2, 8, 8, 10, 10, 8, 10, 8 Lumineers today on our patient.
and now we're not treating teeth anymore. We're treating smiles.
Isn't that beautiful? So let's look at the transformation from where we started and where we are. Our patient today is an example of that. Here we have a patient that has irregular teeth, worn teeth, gingival recession, and in general, she has suffered with her appearance for years. We're going to make a dramatic transformation in her appearance in less than 1 hour. We'll do it without anesthetic. We'll do it by recontouring the enamel, or the non-sensitive tooth structure. So as you can see, she has had a great need for orthodontia all her life, but she was in a family that couldn't afford treatment when she was younger. And now as an adult, she's suffering with the consequences of it. And you'll see it's quite an emotional reaction from the patient just with cosmetic contouring. All right. And if at any time anything hurts, you should tell me right away. Okay? I got this in. So I like to use this ultrafine diamond with a lot of high-speed water spray. And we're going to narrow these centrals. Open wide. Yeah, that's good. And it's going to be amazing how we're going to be able to improve this. And we're not in a big hurry. So we just start taking a little off here and a little off there and watch the cosmetic result evolve. Open real wide. We're going to start focusing first on the patient's left central. Real wide. That's good. And we take a little off the labial surface. And what we're attempting to do is get a rounded, gently curving maxillary left central. Any of this hurt? We always tell the patient while we're doing this, if you start to feel any sensitivity, be sure to tell me right away. Don't endure it and try to be brave, because so often they expect to feel some discomfort. And if I'm doing my job right, this patient will never feel any discomfort, and we'll get a dramatic cosmetic change. Now I'll let you look at that left tooth so you can see the difference. You put your head down, just chin down a little bit. And give her the mirror so she can see it. See how we changed that one tooth for you already? Huh? You like that? Smile now. Okay. Wow. Okay. It's the beginning. Now we'll try to get the other tooth to match it and try to get a harmonious incisal. If for some reason we make the teeth too short, it's no problem because we can always make them longer with Lumineers. I think using 4-power magnification is critical when you're doing this procedure because if you're not, you can't see that well. And here I have complete control and I can avoid sensitive tooth structure. There's a big difference between 4-power and 2.5 power, and most dentists just use 2.5 power and they refer to it as loops. Open wide. We're going to narrow that distal of the right central so that we can try to have the two centrals approximately the same size in mesial distal width. And we're going to take off some of the mesial of the patient's right lateral. And this is one of the most challenging cosmetic contouring cases that I've had to do. Now, most dentists would give the patient anesthetic, grind the teeth down, tell them they had to have it done if they're going to get a good result. And I don't agree with that. And the reason I don't agree with that is because I've had so much success in just limiting tooth removal to non-sensitive tooth structure. If you think about it, if for some reason you and the patient together aren't satisfied with the result, it's a simple matter of just giving the patient anesthetic and removing porcelain and natural tooth structure just like you would if you made a provisional for her to wear. Now we'll let you take another peek.
Oh my goodness.
You like that?
Uh-huh.
Yeah.
Wow.
Can you see the difference already?
I can. God, honey.
Try to get a close-up on that.
Wow.
Okay. Huh? Okay, and put your chin down a little bit. Okay, now big smile. Okay. They don't look like the same teeth, do they?
Wow.
I'm going to take a little bit off here. Open. It's important if I touch anything sensitive that you tell me. You just raise your hand or say something. Now I'm working on the patient's maxillary right cuspid. Cuspids are very critical in achieving an aesthetic result. Oftentimes the cuspids will flare out to the labial at the incisal, and a properly designed cuspid will be prominent in the gingival 1/3 and taper in on the incisal 2/3. So that's what we're going to do here. Okay. And we'll go to our cuspid and our lateral on the left side now. We want to have everything taper. She has bulbous teeth, so we want to remove as much enamel as we can. And get to that bicuspid. It's not quite as critical there. And we're taking off the distal of the left lateral, or left central. Many dentists don't believe that you can achieve a result like this without extensive removal of tooth structure. And I like to take the approach that see what you can get as a cosmetic result without removing sensitive tooth structure. And we'll take the hot plate and show that on the video. And put your chin down on your chest a little bit more, and that's good. And we're going to take a little more off the labial mesial of the left central, and a little bit more off the distal of those. But I'll let you take another look here just for a second. Yeah, right. Smile real big. Take a look. See. Huh? I'm going to take a little bit more off that cuspid. Okay. Open wide. It's amazing how you'll achieve a result, think it looks all right, and then you get away from it and come back to it in a few minutes, and you see some more you'd like to do. The use of water is so critical because heat builds up very rapidly if you try to do this in a dry field. So we want plenty of water all over the surface, even at the expense of having to run down the patient's neck, which it does sometimes. So you see, we've been grinding pretty well now for 13 minutes, and yet we haven't exposed any sensitive dentin yet. But we've certainly modified the anatomical appearance of these teeth so that when she leaves today, she doesn't need a provisional because she's so happy with the result that we've achieved so far. You can do this for many of your patients in your practice without having to do Lumineers, and this, this certainly justifies a fee, and patients would gladly pay you for it. Oftentimes dentists say, well, if I make it look too good, then they won't go ahead with the Lumineers, and I think, well, are you here to help a patient, or are you here to help yourself? So I've always found that the more I help patients, the more I help myself, in the sense that they want to send more patients to me. Now, after we've done a lot of the gross contouring, we like to use a narrow ultrafine diamond to go with those interproximal embrasures. You get a lot more control in there, especially on that right lateral. It's overlapping, and so we want to define those incisal embrasures. We still have a little contouring to do on that right central. Doesn't quite have the taper I'd like to have on it yet. And I'm narrowing the mesial of the right lateral. And then we're defining the incisal embrasures between the lateral and the cuspid. And you come back and you just go over those areas and get rid of those heights of contours. You get rid of that bulbous look to the tooth. Get a nice taper. It's amazing the patient hasn't felt anything yet. None of this hurts, does it? The anesthetic is never required if you are careful with your patient and take your time. I mean, if you wanted to prep these teeth, I know there's some dentists that can prep a tooth in 1 minute, but they use coarse diamonds and they really do a lot of trauma to the pulp. And you want to be conscious of this because these are vital teeth. It's vital tissue that you're working with. And if you're careful with it, you can get some very dramatic results. I don't like the contour in the patient's right central, but we'll get to that. You just let that diamond find the height of contour and it will take off the enamel that should be removed by giving the tooth a slight taper. Is that there sensitive? Okay.
No.
Okay.
The water is going up my nose so bad.
Okay. Anytime you want a break, you let me know. Okay. Now, if we were prepping these teeth under anesthetic, it'd probably take us 4 or 5 hours to schedule an appointment for the patient and give them anesthetic, grind the teeth way down, take impressions, maybe give them a second injection if the anesthetic is wearing off. Big smile. Real big one. You'll even enjoy smiling now after you get this.
He doesn't know how to smile.
Yeah. This is really neat. Okay. Put your head over here now. You've got a lot of enamel here, so this works out really nice. I'm going to shorten that lateral. The lateral incisors are always in ideal occlusion or normal anatomy, always shorter than the centrals. Sometimes on males, when they grind their teeth, they wear off those incisal edges, and so they have the appearance of being even. We're taking that taper off that central so that when we create the lumineer over that, it won't be too wide. And even though that's not an ideal appearance, you're going to see that her teeth look so much better after they get finished just with the cosmetic contouring. And you're toward me. Shortening that right lateral now. One of the things I'm focused on is the distal labial of the right central. I'm going to keep taking more off that, and you'll see as we get to the final stages here that I'll be going back to that a lot more. Seems like once you take one area and get it the way you like it, then something else doesn't look quite acceptable, so you go back and change. Okay, now let's put your teeth together. Close. All the way. And your back teeth. That's it. Hold it right there. Open wide. That left central is really quite prominent, so I keep going back to that a lot. Okay. There's enough dental disease out there where patients need to be petrified, but this is not one of those procedures, and we accomplish so much more for them. The alternatives are a year or two of orthodontia, or a significant amount of tooth structure being reduced. Oftentimes the consequences, as you know, are resulting in pulpal necrosis or endodontic failure. And that's why I like this. I'm not in a hurry. I'm creating a dramatic change in this patient's appearance, and I'm not hurting this patient. I'm taking advantage of the patient's sensory system. So you just go from one tooth, take a little off here, you're just sculpting just like you were a sculptor, only instead of it being stone, it's patient's enamel. Now, not everybody has this much enamel, but generally, when they don't have this much enamel, they don't usually have this much disfigurement either. See, we're taking the right cuspid and getting that to toe in. That's critical to achieving a good cosmetic result. Cuspids that flare out never look good. Just a little bit, put your head down a little bit, that's good. I flatten that left central a little bit more. And I see over here. That's pretty good. Just look how nice they look. She could go through life this way if she wanted to. So we go back and just keep trimming. How do you know when to stop? Well, that's there isn't any definite time when you're finally finished. It's like an artist with a painting. They keep taking off a little more, keep making changes. And probably most artists, when they get finished with a painting, if they had kept it there, they might even do more minor adjustments and modification to their artwork. That's the way this contouring is, but I don't have to get it perfect because perfect is going to come from the Lumineers when we place them on the teeth. Just think of the millions of people who would be grateful if they had their dentist just be aware of cosmetic contouring that could be done. And since it's a rather large investment, many of them don't do anything. And many times they have somewhat limited financial resources. They're real happy having this done. It's a nice service to render to people. Put your hand over here. Okay. I've got my eye on that distal labial surface of that right central. And I want to open those interproximal embrasures so that they have that flow and definition. It's just as in finishing Lumineers, you want to have the definition of those embrasures. Focusing on those interproximals now. Want to get that taper definition of those two teeth. All too often, dentists get sort of a flat, ovoid look, and they don't go back and do the contouring. One of the things about serenade porcelain is that in studies that have shown that it wears like enamel. And so you can take serenade porcelain and you can contour it just like we are doing enamel right now and then repolish it. So we're getting incisal definition now between the laterals and that central to be a little shorter. Most feldspathic porcelains just can't be ground on afterwards without causing micro cracks. Now I'm getting to the distal labial of the right central. That's been bothering me all the time, and I've just been looking at everything else that is more different. See how we just roll that around? That is so important right in there to give that nice tapered look to it. Let's see what that looks like after that. You sure have a lot of enamel.
Is that good or bad?
That's good.
I'm like, huh?
Yeah, that's good. Means I can do a lot of contouring here. without getting to your sensitive tooth structure. Just getting that labial angular appearance softened right there. And I keep taking off more and more enamel. And finally she said, I can feel that, and that's about the time I stopped. But I wanted to get rid of that. See that now, how much better that taper looks compared to the way it looked before? Sensitive? Just beginning? Okay, that's as far as I want to go.
Just a little bit on this one here.
Right. Okay, now let's take a look, see what we have here. Big smile. Big smile. Hard to imagine it's the same person, isn't it? Huh? All right? Big smile.
I can't see.
Yeah, I don't want you to see yet. That's great. Okay, now go ahead and take a look at it.
I can't believe he can do that.
What?
Oh my god.
Isn't that great?
Wow.
Huh?
Mm-hmm.
Open. Now put your head down just a little bit. And let's see. Take a little bit off the labial of that right central. Widen it. Try to move that over there just a little bit. Okay, now take a look at it. Okay, now let's see what it looks like. Hard to imagine it's the same person, isn't it? Yeah, take just a little bit. Never mind now. Take a little bit more off this cuspid. But even though we are almost there, I'm always looking at that cuspid and that right central at the end. In the beginning, I was focused on the left central. And when I got that taken care of, then I was focused on the right cuspid. And then I got the right central focused on that. Now that the others are looking so much better, the right cuspid could also be modified a little bit more. Okay, now what we want to do is take a second set of this. This is after cosmetic contouring. Do your teeth feel rough to you at all on there? Mm-hmm. Okay, let's take and we'll smooth them up a little bit with a long fluted carbide. And we'll just go over that surface and it won't take much off. It'll just smooth it. Open. And then at the very end, you can take some dialite polishing cup with porcelain polishing paste, and that gives it a nice finished result. And I'm going to do a little bit more on that cuspid. Okay. Look at that transformation. All without anesthetic, and all without removing sensitive tooth structure. So the rules for cosmetic contouring is they'll create an optimal arch form for aesthetic and uniform appearance of the Lumineers. No anesthetic is necessary because you stay within the enamel and do not penetrate the sensitive dentin. Cosmetic contouring is done to remove sharp edges, align incisal edges, and to enhance the overall appearance of the teeth. Cosmetic contouring alone will make the patient's teeth look better.